So instead of 4 breakouts, we create just 2 breakouts. Okay, and we will combine the team. So perhaps the wearables and artificial intelligence in one. But I don't see João, so you were Gregor. You are taking the lead on that one, and then when João comes in, they will join you, and we have the participants in the Zoom room and the main room go into breakout room 1 if they want to go. Okay. So, I see. João is already in one of the rooms. Okay. João, are you listening to me in that room? Let him test the conversations.
Paulo, good morning. I can hear you and I can see you. How are you?
Okay, fantastic. That's good that you are already in this in the main room right now, right? Even though you are physically in one of the breakouts rooms. Okay, cool. Is there already participants in your room right now? João?
Yeah, we have all the panel in here. We have Duarte and Ricardo in the room.
Duarte and Ricardo are in the room, right? Okay, that's cool. So what I'm since we don't have that many participants in Zoom, in order not to separate all the sessions, we are going to combine. You and Gregor will be in one room, okay, together. So the discussions would go on wearables and artificial stupidity. You have to combine this in order to make more participants joining you. Otherwise, you will be risking to talking to less people. And this will enrich, of course, the conversation. So that's one breakout. And the second breakout will be led by Sylvia and Carlos Jaime. Where is Carlos? I think he would be, and Lionel. Lionel? Richard? Oh, Lionel, can you turn off your camera on so we can have you in the visibility?
Mute. Tirar o áudio. Vocês têm algum PowerPoint para passar? Eu tenho aqui ou não tenho?
Hello? Lionel? Lionel, are you with us? Okay, so let's have a quick poll here in the Zoom. If we can do that, Sylvia, I not hear you. Zoom team in the Reis, can you create a quick poll to understand who is interested in going for team artificial stupidity and wearables? That's one. And the other question the other question will be who would go to hospital for repairs and CDSS. So we have a number of participants. And in the meantime, while we are preparing the pools to see in the audience who want to go to one or the other, maybe we can ask Lionel again. If Lionel, Julius, and oh, hello, Lionel. Good to see you again.
Hello. Sorry, I was talking with Carlos on my phone on the same time to try to understand when we have to come and when we have to join you.
Okay. No, you can join now. So if Carlos is on Zoom, he can join us also on Zoom.
Okay. So happy to see you. Sorry, I'm in Belgium actually, where the weather is very good, but I wish to be. I were in Porto with you.
Oh, I wish to. Well, while just to checking in, Reggie, they're working in the pool to create the pool, right? And in order to do a quick assessment of who in the Zoom will go to one or the other breakouts, we have 18 participants. Welcome all. So perhaps we could start with a round of introductions by you, dear session leaders and guest speakers. Okay, so I will ask each one of you to please briefly introduce yourself and explain a little bit your stake in terms of the health data, what do you say, discussion area. We are talking about health data in a field. It's not even a field, I think it's a discussion area. So briefly you can do that, and in the meantime for the participants, you please be so kind to select on the pool which rooms you would like to go. And let's start speakers introduction by alphabetical order. So this way everybody knows where to start. I think it's you, Dimitri. Dimitri, yeah.
Hello. I don't know, I'm not sure. Let's see, which mic does work? This one? Oh, okay, this one works. Good morning, everyone, and a pleasure being here. So my name is Dimitri Etin, Oracle Healthcare, and I'm a guest speaker at the now combined session, right? So which combines the hospitals are for the repairs and the
clinical decision support systems.
And the clinical decision support systems. So my idea was, as initially that was the hospitals for repair, I think that our idea was to speak a little bit about the boundaries that we may face today when the hospitals transit into a more, let's say, modern way of operations. And myself, as the technology guy, the data management guy, I was thinking to speak about the boundaries that we actually can break using the technology that helps to support this transitioning role of hospitals within this kind of new world of home care, patient monitoring, and whatnot. So it'd be a pleasure to see all of you joining this breakout session. Thank you.
Thank you, Dimitri Etin, for your kind introduction. I would also would like to invite if are there any participants watching us live in YouTube, social media, etc. If you would like to join the discussion, because we are going to create the breakouts in a few minutes, you can do so by joining the Zoom session, the Zoom link. So if you are a registered participant in this summit, please go check your mailbox and you can join the Zoom session, because in a few minutes we are going to stop the transmission, the live transmission, and we're going to focus on in-depth discussions only. Okay.
Paulo.
Yes.
Paulo, may I ask for something?
Sure.
I wouldn't want to mix like you just did. I'm perfectly happy to have artificial stupidity session with as few people as come. I have two of my guests here, so Miguel and Aleks. And even if I just spoke to them, I would be perfectly happy, but I would not be happy to mix it with wearables and other technology. So if you let me go into the breakout room now, and we just start the discussion, that would help. That would make me happy.
Okay, no problem. And by the way, we are already seeing that there's a sufficient interest for the artificial stupidity station. The wearables is less popular, so you have already a good critical match. Reggie, can you now ask for the other two questions, for the other two questions? Because now we know that we have artificial stupidity can go on its own. And we have that already, that critical mass. Now we have to ask our participants on the two teams, so we can combine. So wearables, perhaps should we combine with another topic? But this is the dynamics of a peer conference. It's really this. If Gregor is not comfortable in the team, he says, express sense, and we have to organize according to everybody has to be comfortable.
I may suggest that wearables, I think they can be well combined with the hospitals for repairs, because if we speak about, the patient remote monitoring and whatnot, and how to break the boundaries. Wearables are one of the good things to support this. So maybe that's a good one to combine.
Fantastic, Dimitri. And João, are you comfortable with that?
Yeah, sure.
Okay, so that's a good decision we can make. Let's now shake the pool for the two other subjects, or otherwise Dimitri will go to the room where João is, and you'll start the discussions there. But okay, so now Carlos is on the conference also.
Yes, we are in the meeting room. Sorry.
Okay, fantastic. So we have already the two meeting rooms prepared. Fantastic, and we don't need more physical meeting rooms. So let's keep the round of introductions for all speakers, please. And then when all the speakers do the round of introductions, we'll invite everybody to go to the breakouts. The speakers will go to their corresponding breakouts, and then you start the conversations there. Is this understood? Okay, so Dimitri did the presentation. Second to do presentation is João. João?
Yes, I'm here. Good morning.
Good morning. Can you present yourself and what's your stake on the HealthDay?
Não temos ninguém. Tá bem, bom, nós fazemos então. Nós fazemos a gente pode juntar no...
Please shut down the other rooms. Just João agora. Yes. João, go ahead.
Fantastic, I'm here. So I'm going to make a start. Well, first of all, bom dia. And Paulo, first of all, congratulations and thanks for inviting me to be here in Portugal. I'm delighted to be here. You've done a great job so far in bringing all the stakeholders together. And also I'm delighted to be here with Ricardo and Duarte to have this conversation around wearables and health data, or wearables and artificial stupidity, or wearables and personal connected data. So wearables goes really well. My name is João Bocas, also known as the wearables expert, and I have been playing a role in digital health globally, and my vision is that wearables can change the world. So I'm looking forward to the discussions, starting this conversation. Also, I have a very short presentation that I would like to show you my vision and also to address some fundamental issues around wearables. So delighted to be here. Thank you.
Thank you so much, João. So by alphabetical order, next will be Lionel. Did I miss someone? Oh, Gregor, sorry. I apologize. Gregor.
Yes, so my name is Gregor Cuzak. Thank you, Paula, for inviting me. Thank you for being in Slovenia in the end of August. And I don't see where is Pedro, but you know we really cherish the connection that we have with you guys. So in terms of my role, I'm actually definitely not an AI expert, but I do get to talk to many. So I'm really happy about the preparation that we had for this. Not just that Aleks and Miguel that we spoke before this, but I had a really detailed discussion with I would say about 8, perhaps even more experts in the field of AI. And of course, the controversy here in the title is there rather to invite to a debate, not to sort of create a clash of opinions, etc.
Of course.
So I would be really happy if I could start this discussion. As soon as you let me in, we will start.
Fantastic. We'll do that, Gregor. Thank you so much. We still have time because we have to start at 10:30 as we agreed. So it's the buffer time needed. In the meantime, you are introducing yourselves. I forgot about Aleks Jakulin because Aleks is in the Zoom room, but he didn't turn up the camera. I'm not sure if he's still with us. I forgot about him. He's in alphabetical order. This will be the first, Aleks Jakulin. But anyway, we follow now. Lionel, over to you. Presentation and your stake in health data.
Okay, good morning. So thanks for inviting me. I'm French, as you can hear, and I'm a blogger on digital health for a long time. I wish I could have met João personally in Porto, but we will discuss, as we say, by mail and visio. I'm very happy to do this part with Carlos from Ascom on CDSS, moving from reactive to proactive and maybe predictive care model. This is how we do to transform our sick care system to a healthcare system. So that's it.
Okay, thank you, Lionel. Okay, following alphabetical order, if I'm not missing anyone, Miguel, right?
Hello, everyone, and good morning. So I'm Miguel Coelho. I'm from Oracle's Healthcare Global Business Unit, where I'm responsible for sales into the EMEA and Latin American markets. I will be discussing with Gregor on the artificial stupidity topic, and hopefully bring a little bit of the vision of the IT industry that, yeah, hopefully there may indeed be some intelligence waiting for us at the other end. Yeah, that will hopefully bring palpable and concrete benefits to the healthcare provision. Okay. So yeah, looking forward to that discussion.
Thank you, Miguel. Thank you so much. I kindly ask Urske to check if Aleks is back on the Zoom, because I saw him earlier, but he didn't have the camera on. That's why I didn't introduce. And also Carlos Jaime. Carlos, I think I missed your introduction.
Olá, Paulo. Olá a todos. I will do it in English, sorry. Just a reflex to do in Portuguese. Yeah, as already explained by Lionel, where I'm with Gianluca and Steve from ASCOM. The subject of moving from reactive to proactive medicine, it's really a focus project for all the hospitals, because now we are playing since long time, and we are discussing about AI on digital health, but in real life, I think the real life is so different, because they are not using as expected the data. They are not moving the way to do medicine with the new tools. We are still, this is my understanding, we are still in the working in progress in the real life. The main issue we have currently is the access of data, or the right data in real time, and this is why in the day-to-day life for medical staff is so different. On my subject, on what I would like to discuss with you, how can we move from theory to real practical medicine with digital health? Yeah, I'm involved since more than 10 years in digital health. I know a lot of you, and we are particularly involved with Lionel in French market. The feedback after this pandemic crisis is still, I think, stronger than before. They are suffering a lot. The medical team are suffering a lot about digital, EHR pressure on the digital tools. And we are not helping people to do better medicine and to have a better environment for medicine.
Thank you, Carlos. Thank you so much. Now, going back on the order of presentations, I think next will be Sylvia, right? I'm not missing anyone. Sylvia?
Yeah, no, that's me. So hello, everyone. I'm Sylvia Piai. I'm Research Director for IDC HealthySystems, which is the practice of IDC entirely dedicated to healthcare and life science. I actually lead the European team, and basically researching on the key trends of digital transformation across healthcare and life science. Besides that, I'm also lecturing health IT management and a master's degree for healthcare organization management at Applied Science University of Krems. I was supposed to actually be one of the co-leading the hospital Hartford repairs session, where we, as Dimitri explained, we were about to talk about the evolving role of hospitals. So we are now joining the clinical decision support and AI-driven paradigm. So looking forward, and actually this is very topical because we know that a lot of use cases are within the hospital realm of AI. So really looking forward to join the session.
Okay, thank you so much, Sylvia. So now for the breakouts, I'm not sure if Zoom team can change the names now, right? Because the names were created. You cannot change the names, right? Okay. So dear participants, think about artificial stupidity's one session, and Hospital for Repairs will include the wearables. That will be in the second breakout if you want to discuss wearables, okay?
Okay, so sorry, I misunderstood then. All right, so
you are leading the session, Sylvia, don't worry, you'll be leading.
No, it's not about leading, it's about understanding exactly where I will end up to, because then...
You end up in breakout Hospital for Repairs that is created for you. Is that clear for you?
Okay, that's fine, okay, great,
fantastic.
Thank you.
And it will be good that you lead the discussions and prepare whatever you have prepared. That will say co-lead with clinical decision and with Lionel and also with João. Okay, so I think we have the introductions of everyone except Stephen. Last but not least, Stephen.
Hi everyone. So I am Dr. Stefan Buttigieg. I'm a specialist in public health medicine. And I'm also the vice president of the UFA Digital Health section. So UFA would stand for European Public Health Association. I wear a couple of hats, and I'm also the co-founder of Digital Health Malta, where over there I'm one of the hosts for our newly launched podcast, The Digital Health Voice. You might have heard about it. And I'm also lecturing at the University of Malta on digital health. So doing a couple of things, but the job that I do on a daily basis is I am one of the co-leads of the data management team for the COVID-19 public health response. So you can already start wondering what approach I will be taking throughout my presentation. I will try to present something extremely quickly because I'd love to put, what I've learned about about how hospitals will tackle the future of healthcare. And I'm really delighted to just be here, Paul. I'm really grateful for your invite. I really appreciate it.
It's a pleasure to have you, Stephen, a thought leader. And I'm really honored to have this collection of thought leaders here running this peers conference, and hope that the participants can join. So Zoom team, thank you so much, Zoom teams, for accommodating these last-minute changes. Sylvia and dear guest speakers, session leaders, please go to the breakout rooms now. We're going to stop the transmission in a few seconds. Participants in the Zoom, please select your breakout room. Everything is ready for you there. You just have to go to the breakout option and select the room where you want to go. The main room here is going to be closing, okay? Participants in auditorium, so if you want to join some of these discussions, if you are happy to stay here, if you want to work or just being here, we are now closing the transmission now. And if you want, you can ask the team hostesses. They will leave you to the rooms that are now starting. They're about to start right now. And here I have to tell the Zoom participants to please select your breakout room. The transmission here is going to be closing real soon. And also for our dear participants on the social media, YouTube, I know that there's a lot of people following us in live in YouTube, LinkedIn, and maybe you are right now too busy to go into the discussions here in depth. If you have the Zoom access, please join Zoom, because now the discussions are going to start in depth and we are not going to live stream them. We will be back on the live stream here at exactly 12 o'clock. So 12 o'clock British Summer Time and West, which is local time here in Porto. 12 o'clock we'll be back here. That will be 1 o'clock Central European Time. This will be 6:30 India time. I know that some participants from India will also likely to join us. And of course, in the morning, I think in this 12 o'clock local time plenary closing panel. I'll have with me Laurie Ringert from Canada. It's still too early in Canada, but she will join us at 12 o'clock, which will be 6 o'clock her time. And then we have a moderated conclusions here for the social media transmission live. So without further ado, Regie, please stop the live transmission now. Our viewers will be back here in 90 minutes. Zoom participants, please go to your own rooms, and this room will be just for the ones who want to stay and work here in the auditorium. Perhaps, Regie, you can put the view of the empty auditorium here and stop the live stream, of course. Yeah, thank you. Just checking on Zoom. Is everybody now on their...
Welcome to the tomorrow of healthcare in the Oracle Cloud. A place where disruption is your reality and digital agility is the cost of entry. This is a world that rewards those who embrace bold ideas, fueled by intelligent data. This is a place where healthcare stays focused on caregiving, where health plans, hospitals, and health systems become active enablers, engaging patients as dynamic participants in their own wellness, where every aspect of the business of healthcare is orchestrated for organizations, intelligently automating, reducing human error, freeing you to progress your mission, where healthcare professionals are nurtured, developed, and given real-time feedback to help them better care for others, where operational excellence and people-first experiences meet clinical excellence, where administrators and caregivers work as one, intelligently and proactively gaining the insight to focus services and resources where they have the greatest impact. Take command of the digital age. The future of healthcare in the Oracle Cloud.
Pela família, pelos amigos, pelas férias, pelo futuro, pela sua saúde. Não adie mais o que ficou esquecido. Em 2020, quase 5 milhões de exames clínicos não Covid ficaram por fazer. Pela sua saúde, não adie mais os exames que o ajudam a cuidar de si. Unilabs, há uma química que nos une.
Sometimes it's hard to come home and act as if you didn't just witness something life-changing. Because you did. You were part of a critical moment in someone's life. And it makes me wonder, why is this my choice? Why am I a nurse? I know I can't change the whole world, but I can change it for one person, even if it's only for an hour or two, by being there when it counts. Nursing is a process. Assess the patient, implement care plans, get the right people together. Heart rate under 15, temperature 38.5, saturation 88. Could it be a surgical site infection?
Get infection parameters over there in 5.
And technology enables just that. Connect with the colleagues, access and share information, prevent documentation errors, stay by my patient's side. It means I can do a little bit more for my patients.
Hi Michael, you have problems with your leg? Send it to ICU.
And I get to change their world.
Hang on, guys.
And I just know.
Thank you.
This is what I'm meant to do. That's why I'm a nurse.